Hi guys, welcome back to Codemaster Coach, your medical coding tutor. In today's video, we're going to be talking about what do we code from? Where do we get our information to assign our codes from? The answer is the medical record. The medical record contains the documentation for the reason that the patient came to the hospital in the first place. It contains tests performed, their findings, therapies provided, surgical procedures, daily record of the patient's progress, and whatever else the physician documents. Now remember, this medical record can be either electronic or in paper form. More and more today we're beginning to see more electronic records. Now, an inpatient medical record contains what's called a discharge summary or a final progress note. This discharge summary is in the form of a summation of the patient's stay. It includes the reason for the admission, significant diagnostic findings, any treatment given, a follow-up plan, and the final diagnostic statement. Now, a stay less than 48 hours requires a final progress note. So a summation of that patient's stay will either be in a form of a discharge summary or a final progress note. And remember, that stay has to be 48 hours or less to justify a final progress note, which is usually only a paragraph long. And there's not a whole lot to document. But a stay greater than 48 hours does require a thorough discharge summary. You also have what's called a history and physical examination. It's completed the day of or within 7 days of admission, and it contains the patient's chief complaint, reason for the admission, history of the complaint, how long they've had it, family and social history related to the complaint. Is it genetic? Is it something that other family members also have? Is it something because of their lifestyle, a disease process, or a condition because of their lifestyle? An examination of the patient include the body systems review, from head to tail usually, and then a plan of care. So you have the history and physical on admission and a discharge summary at the end of the stay. And in between there you have daily progress notes. Each day that a patient is in a hospital, the physician should document daily progress notes that are brief statements of what's going on with the patient. And I always try to remind my students, as long as the patient is in the hospital, there should be a daily physician progress note. Long-term care, once every 30 days. Subacute care, once every 3 days. But as long as they're in a hospital setting, there should be documentation or a progress note every day that that patient's in-house. Additional documents that you'll see in the patient medical record include x-ray reports, which help me as a coder, because if the physician says the patient has a fractured femur and that's all he gives me, I can go to the x-ray report and determine where was the fractured femur. Was it at the head of the femur or on the shaft of the femur, or where? Another report is a path report, a pathology report. Now remember, a path report is generated whenever any body part is taken out of the patient. So for example, a patient goes in and has a colonoscopy and they find polyps, and those polyps are removed. Those polyps are sent over to pathology, and they analyze them to determine if they're benign or malignant. Or if a patient has an appendectomy and the appendix is removed, that appendix is sent over to pathology, and they examine the appendix to determine, is it truly appendicitis? Was that appendix inflamed? MAR is medication administration record. That helps me as a coder, because a lot of times I'll see where a patient or a physician is treating a patient for a urinary tract infection, for example. And I can see the documentation, but he didn't state it in his discharge summary. And I can look on the MAR and see where, because the MAR is the list of all medications that were given to the patient during the stay, he treated the patient for it. That helps me in my query, which we're going to talk about in just a few minutes, in my questioning to the physician. Didn't this patient have a UTI? The MAR shows where you treated the patient. with Bactrim. Okay? Now, on an outpatient basis, there's not much to document. Because remember, you're going into your physician's office with a headache, and all he has to really document is that you have a headache and he gave you some pain medicine. Your blood pressure was this, what few body systems he may review, you know, so it'll be a brief progress note. So that's all you're going to really have on an outpatient basis. So an outpatient medical record is usually just progress notes of each time you came to see your physician in his office. Now, if for any reason you're still unable to determine your diagnoses, a physician query or a physician confirmation should be requested. And what this is this is a form. We usually do it in paper form because we want the physicians to document to us, to write it down. Yes, patient did have a UTI. And once I've got his documentation that says it, then I can code it, but without it I can't. This is a form requesting a physician to explain or give specificity in his diagnoses so that I can more accurately code it. Okay? And our rule of thumb in coding is if it's not documented, it's not done. If it's not documented, it's not done. And a lot of times you will see it get done. You'll know it. You'll know that it took place. And I've always said that my nurses are my hardest coders to bring around. And it's because they know what should take place or what goes on. But if that physician did not document that he did it, you cannot code it. So just always tell your physician, if it's not documented, it wasn't done, therefore I can't code it. Because this is going to, your codes, your paperwork, your records are going to be going to the third-party payers, the insurance carriers, and they're reviewing the record. They weren't in the office, and they're reviewing the record and your codes. And if the record and your codes don't match, they're not paying. Okay? So your rule of thumb, if it's not documented, it's not done. Okay, so guys, when you get time this week, look up Discharge Summary, History and Physical Examination, X-ray report, Path report. Look and see what those documents look like so that you'll be familiar with them when you see them in your healthcare setting. That's it, guys. Any questions or concerns, email me at codemastercoach@gmail.com, and I'll see you in the next video. Thanks.